Have you ever wondered what happens when a patient's health puzzle is so complex that it takes more than one expert to solve it? Today, we're pulling back the curtain on a revolutionary approach in medicine where superheroes in white coats, cardiologists, neurologists, and oncologists unite. This isn't a medical drama. This is the real life-saving world of multidisciplinary care. Stick around to see how this incredible teamwork is transforming patient outcomes and redefining what's possible in medicine. Let's start with a foundational question. Why do these specific specialists need to collaborate? The answer lies in the intricate connections within our own bodies. Think about it. Cancer treatments, while incredibly effective at fighting tumors, can sometimes have unintended consequences for the heart and nervous system. This is where the term cardio-oncology comes into play. It's a growing field dedicated to protecting the heart health of cancer patients before, during, and after their treatment. An oncologist might be focused on eradicating cancer cells with powerful chemotherapy drugs. But what if those same drugs pose a risk to the heart muscle? That's when a cardiologist steps in. They'll conduct baseline tests like an echocardiogram to assess the heart's current condition. Throughout the treatment, they monitor for any signs of trouble, like a decrease in heart function. They can suggest protective medications or work with the oncologist to adjust the cancer treatment plan, ensuring the fight against cancer doesn't inadvertently create a new heart problem. It's a delicate balancing act, a partnership that saves lives on two fronts simultaneously. Now, let's add another crucial player to this team, the neurologist. The brain and nervous system are the body's command center. But they're not immune to the effects of cancer or its treatments. A condition known as chemo brain is a perfect example. Patients often describe it as a mental fog, struggling with memory, focus, and multitasking. It's a real and frustrating side effect. A neurologist can help diagnose the extent of these cognitive changes and develop strategies to manage them. But the neurologist's role goes even deeper. Some cancers can spread to the brain or spinal cord, and certain treatments can cause nerve damage, a condition called peripheral neuropathy, leading to pain, tingling, or numbness in the hands and feet. In these cases, the neurologist works hand in hand with the oncologist. They help manage symptoms, prescribe therapies to protect nerve function, and contribute to a holistic treatment plan that addresses not just the cancer, but the patient's overall neurological well-being and quality of life. So, how does this all come together in a real-world scenario? Imagine a patient. Let's call her Sarah. Sarah is diagnosed with a type of breast cancer that requires an aggressive chemotherapy regimen. Her oncologist knows this treatment has potential risks for her heart. Before she even begins her first infusion, she's referred to a cardiologist. The cardiologist assesses her heart, finds it strong, but puts a monitoring plan in place. A few months into treatment, Sarah starts noticing a persistent pins and needles feeling in her fingers. Her oncologist brings in a neurologist. The neurologist diagnoses it as treatment neuropathy and recommends specific medications and physical therapy. The three doctors then have a joint consultation. They review Sarah's progress, weigh the risks and benefits of her current treatment, and decide to slightly modify her chemotherapy dose to lessen the side effects, all while ensuring it remains effective against the cancer. This is the power of collaborative care. Instead of Sarah having to navigate 3 separate appointments with doctors who might not be communicating, she has a unified team. They see her not as a set of isolated symptoms, but as a whole person. This coordinated approach prevents crucial information from falling through the cracks, reduces conflicting advice, and ultimately leads to safer, more effective treatment. It's proactive, not reactive. The goal is to anticipate problems before they become severe, preserving not just the patient's life, but their quality of life for years to come. This model of care is often formalized in what's known as a multidisciplinary tumor board. This is a regular meeting where specialists from various fields: oncology, cardiology, neurology, radiology, pathology, surgery all come together to discuss complex patient cases. They pool their collective expertise, debate the best course of action, and create a single, unified treatment plan. It's like having a medical dream team dedicated to each patient. For the patient, this means they are receiving the benefit of dozens, sometimes hundreds, of years of combined medical experience, all focused on their unique situation. The benefits extend far beyond just treatment planning. This collaboration is fueling groundbreaking research. Cardio-oncologists are discovering which patients are most at risk for heart complications and developing new ways to protect them. Neuro-oncologists are creating better therapies to combat cognitive side effects and nerve damage. By working together, these specialists are identifying patterns and asking questions they might have missed in isolation. This synergy is accelerating the pace of medical discovery, leading to a future where cancer treatments are not only more powerful, but also much safer and more tolerable for the entire body. It also profoundly impacts the patient's emotional and psychological well-being. Facing a serious diagnosis is overwhelming. Knowing you have a cohesive team of experts in your corner, all communicating and working together for your benefit, provides an incredible sense of security and hope. It reduces the burden on the patient and their family to be the sole coordinators of their care. It builds trust and empowers patients to be active participants in their treatment journey, knowing every aspect of their health is being carefully considered. This peace of mind is an invaluable part of the healing process. So, the next time you hear about a complex medical case, remember the unsung heroes working behind the scenes. It's not just one doctor, but a dedicated team of cardiologists, neurologists, oncologists, and many others, combining their knowledge and skills. They are the architects of modern, patient-centered care, proving that when brilliant minds unite, they can do more than just treat a disease, they can truly transform lives. This collaborative spirit is the future of medicine, and it's happening right now. Thank you so much for joining me on this deep dive into the world of collaborative medicine. If you found this information insightful and inspiring, please give this video a thumbs up and hit that subscribe button. Don't forget to ring the notification bell so you won't miss our next video. We love hearing from you, so please share your thoughts or experiences in the comments below. Until next time, stay curious and stay well.